So you've made the decision to get help, but you're wondering who to trust. What's the difference between a psychiatrist, a psychologist, a social worker, a therapist, a counselor, and all of those other terms? Hi, I'm Kim Long, and I'm with Doja Psychological Services in Spruce Grove. So I'm going to try to break it in the basics, although there have been some recent changes that I'll need to try to incorporate. So first of all, a psychiatrist is actually a medical doctor. So they went to school first and got their medical training, and then they went back to school, believe it or not, got specialized training in mental health. And so as a result, you'll see after their name MD for medical doctor. They are able to prescribe medications. Back in the day, they used to provide talk therapy, and some psychiatrists still do, but it's more rare. So generally, if you are seeing a psychiatrist, you are seeing them in order to receive a prescription or some sort of psychotropic medication, which is to help you with whatever's going on with you. To see a psychiatrist, you do need a referral. Now, a psychologist is a little bit different. Just like myself, we have also gone to school for a really long time. You can see a bunch of letters after our name as well. We are not medical doctors. We do not have the medical training, but you can see PhD, PsyD, MC, MPsy, MA, or R-Psych. What you're really looking for is the R-Psych, because that means that we are registered psychologists. We have had to take a bunch of specialized exams, such as our EPPP or our ethics exam. Both are required, and we have to go through a bunch of supervised practice. We have to, in Alberta anyway, we have to get 1,600 hours of practice before we can register. And we cannot prescribe because we are not medical doctors, and you generally don't need a referral to come see us. So you can look anybody up and go to talk therapy. Now, there's a new definition for psychologist through this, and this is because there are some significant changes coming through the pipe about some of the other things I'm going to be talking about later on in the video. So I'm going to give you the new definition of psychologist now, and then it'll become a little bit clearer why there's the need for that. Okay, and I have to read it because they're detailed. Okay, so what the Psychologists Association of Alberta sent out to all of us, coming regulation of counselors and psychotherapists. It's important that we are able to clarify the differences between psychologists and other professionals. So that's the need for the new information, because the term counselor and psychotherapist before was not regulated by law, and I'm going to talk about that in a little bit. So, the new definition of psychologist is: psychologists are regulated health professionals who provide services including psychotherapy, assessment, diagnosis, and research of psychological health problems. Are trained in evidence-based practices and follow a code of ethics that promotes respect for dignity and fair treatment. Alberta psychologists have advanced university degrees such as a master's or a PhD and undergo extensive supervised training and examinations. The biological, cognitive, emotional, social, cultural, and environmental determinants of behavior, and through such extensive research and practice, psychologists help people cope more effectively in daily life. So that is the new official definition of psychologist according to the Psychologists Association of Alberta. There's so many organizations, my tongue gets tied. Anyway, basically psychologists are the ones that provide talk therapy. Now you have social workers. Social workers, generally the letters you will see after their names would be W and registered clinical social worker. So in order to provide talk therapy in Alberta as a social worker, yeah, that was easy for me to say, they need to be able to be a registered clinical social worker, meaning that they have to have their master's. And in that sense, it's similar to psychologists in Alberta, because you will need to check with your province or state about whether or not it's true for all social workers. I'm just talking about Alberta. But basically, they've had to get a bunch of practice hours under the guidance of clinical social worker, and they do not prescribe medications, and you do not need a referral to see them. But they will also provide talk therapy. And just as with any profession, you need to find your person that fits you. The other thing about psychiatrists, psychologists, and social workers is that in general, because they are regulated by law, if you have some sort of benefit plan, some sort of insurance plan, if you go to see any one of those people, you will have some coverage through that plan. Okay, so here's where we get into the term being protected by law. So what that basically means is that we all have a college that we have to go to be licensed. That's where stuff. It's the college's job to make sure that you as a client are protected. So we need to meet certain regulations and certain outlines in order for us to be ready. So not anybody can call themselves a psychiatrist, a psychologist, or a social worker. If they try to do that, they're in big trouble with the law. Right now, anybody can call themselves a counselor or a psychotherapist. Like, you could go out tomorrow, hang up your shingle, and call yourself a counselor, and it's fine. That is, as I is in the process of changing. So, the CCPA, the Canadian Counselling and Psychotherapy Association, and other bodies across Canada are working really hard to cover the terms counselor and psychotherapist so that you can be sure, this is about protecting the public, you can be sure that that if you're going to see somebody, they have been vetted, I guess, like, so the likelihood of them causing harm is smaller. So, for example, one of the terms right now that the CCPA has, and the CCPA is the Canadian Counselling and Psychological Association, they have something called a Canadian Certified Counselor, which is the CCC. If you see somebody who has a CCC designation after their name, then that means that the Canadian Counselling and Psychotherapy Association has done the legwork for you and made sure that this person at least has a master's, that they have the required training, that they've taken, like, in order to retain the CCC, you have to take additional education once you've received it. So it protects the public, which is the goal of the college or the goal of any licensing. This is also true for some other organizations, but you need to look into them and check them for yourself. Otherwise, this video is going to get even longer than it already is. So it's going to, you'll just need to stay tuned to see when counselor and psychotherapist are licensed. And you can also take steps to make sure that you are protected when you are trying to find your person. So, in summary, psychologist, social worker, protected by law. That means somebody else has protected you. Prescribe medication, need a referral. Psychologist and social worker, talk therapy, don't need a referral, no medications. Counselor, not covered by law. That's law stuff. Okay. So, if you're looking with therapy,